Hello, 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 everybody. Welcome to the Kathy J Show. Happy holidays, everybody. I am Kathy J, and I hope you're enjoying this season and all of the wonderful things that it's bringing you guys. Thank you, thank you, thank you very much for tuning in today. We really appreciate all your support. You can also connect with me anytime. It's KathyJShow.com. There was somebody logging on at 2 o'clock in the morning. I appreciate that, everybody. So if you've missed any of our previous shows, that's where you can go. Now, here you go, everybody. You already saw my expert. They just flashed to him. He's here. Dr. Don Cooper is here, everybody, because you know what? We're all going through health issues, stuff like that. And you know what? We need to lean on the scientists and the people that study for their knowledge and their experience, because I don't understand medicine or science, but I like people that do. I need to know how it relates to our lives and our well-being. Dr. Don Cooper from Ramos Law, one of these amazing experts. He has a PhD in neuroscience, a postdoctoral fellowship in neurophysiology, not to mention he's a principal investigator for COVID-19 diagnostic testing. I got it all out in one sentence. How are you doing today, Dr. Cooper? Thank you so much for being here. Okay, so to everybody out there, he's also the director of the Medical Sciences Division at Ramos Law. So let's start there. What is the Medical Sciences Division? What is that?
Well, this is something that Joe Ramos and I have been friends for a couple of years now, and we've been business partners on a number of different ventures. And it's something that Joe approached me a few months ago, back in August, and he said, you know, I'm really interested in forming a medical science division, and I'd like you to lead it.
Okay.
And in part, we had been working together on a number of different things. We'd written a few patents together. We've done a couple clinical studies together. And he said he was really frustrated with the lack of true quality science in law, science and medicine. Now, his background as an emergency ER physician and practicing physician right now, as a professor at CU. We were both professors there. So he has a very vigorous interest in science and understanding of it.
Yes.
And so he felt like that's something that we could be a national leader on, and that we could attack three components. There's three components he asked me to lead in the division. One of them was, he said, you know, we get daily calls for people for medical malpractice. And he says, you know, we don't do medical malpractice. As a physician, it's not something that he can do. A lot of times he's conflicted out. And so, but what he says is that a lot of times they refer them out, and people come back to me and says, you know what? They told me I didn't have a case. And he says, you know, 99% of these medical malpractice, there's not actually a true case.
Okay.
And he says, when you look at it, what he's found is that people are very frustrated that when they get turned down, they don't understand why.
Yes,
and so
nobody was explaining to them
nobody
why
was
they
explaining,
were turned down.
not at all. So he said he's taken the time to go through he'll go through hundreds of pages of medical records
just to tell somebody
just
the right
to tell
answer.
someone, okay, here's why.
That's
and he
awesome.
says that people were so thankful that he said this is something that we should do. Nobody else does this, but this is something that we should do, and I want to formalize that. And that's a service I want to do not only for people and individuals and families so that they have some closure, but also for other law firms. If they have a case that's come before them, they don't understand the science and medical background, that they could give it to us, we could evaluate it, and they could take it from there.
Right, so there's not that many law firms that have a medical sciences division. You're one of the only ones that's doing this.
Right,
because
exactly.
you're one of the only ones that cares enough to help people get an understanding of what they're going through.
Right.
You know, it's not just I went in for a liver or for something on my kidney and they took my arm. It's never that obvious,
no,
right?
It's not.
And it involves so much. So, okay, so stop right there. When we come back, everybody, we're going to get into more of this with Dr. Cooper, including the work he did in Africa, and we're going to learn about what diagnostic testing is. We'll learn that. We'll be right back. Ramos Law is an official partner of the Kathy J Show. He's a medical doctor and a lawyer. Ramos Law, what makes us different makes us better. Welcome back to the Kathy J Show, everybody. So Dr. Don Cooper is here today, and he's the Director of Medical Sciences Division at Ramos Law. His background is beyond impressive, everybody, especially when it comes to his travels to Africa and the work he's doing with diagnostic testing. And that was before the pandemic, everybody. So before we get into that, Dr. Cooper, you said that Dr. Ramos came to you and said, I want to do the Medical Sciences Division with three things that we're going to work on. One is help people understand why they've been turned down for their malpractice lawsuits. The second one was what?
So the second one one was medical product liability.
Oh, yeah.
So this is a big problem now. For example, Congress just released a report that said that most of the major providers of baby food had high levels of heavy metals.
What?
And so people don't expect to buy baby food and to have heavy metals.
No.
But these are some of the things that in order to take on these types of cases, you have to have a good understanding of the physiology, how heavy metals affect developing organisms in the brain.
Oh, yeah.
And so that's just one example, but there's several examples of medical product liability that he gets calls on every day, and they haven't set that up. It hadn't previously done that, and that's something he said he wants to make a priority for the Medical Sciences Division.
Okay, and what was the third thing?
The third one is an up-and-coming one that we think is really going to be important, and that is vaccine injury.
Okay.
So vaccines, there's a lot of discussion about vaccines right now,
yes.
especially with COVID vaccinations. But vaccines have been around for a long time,
yes.
and they've been mandated for a long time, going back to the 1980s, where kids today they have to get 10 to 20 different vaccines just to go to school.
Yeah.
And so there's something that those are things, they're a particular class of drug that are given to normally healthy people, young people who don't have a problem, or elderly and our most vulnerable individuals or immune compromised.
Right.
And so there's an extra layer of safety that's important for
Absolutely.
FDA to go through that. And right now we're getting calls about, hey, I was injected with a vaccine, now I'm having a vasculitis, or I'm having neuritis, or I'm having long-term shoulder injury. And we're starting to see that although it's a very rare phenomena, maybe 1 in 10,000, 1 in 30,000, but if you're injecting 400 million doses,
yes, right.
that ends up being tens of thousands of people who have a serious injury. And the government has set up a program to help people, if they have those injuries, to get claims
yes.
for that. And we want to help them evaluate their case and put the best foot forward with the most sound science so that they can be compensated for
Absolutely. And you're not just talking about COVID vaccinations. You're talking about anything that falls under the umbrella of vaccinations.
All
right.
vaccines right now. And so the program was set up in the 1980s. It's paid out $4 billion to thousands of people since then.
I had no idea.
Right.
So we're going to have to get into Africa in the next break. But so by the government building that fund, they are putting out the vaccine, knowing then that some people are going to have an injury from it. Is that what they say when they create a fund?
It's just a probability thing, because we know that there's a certain fraction, let's say it's 1 in 10,000 people get some kind of serious injury, and that could just be an allergic reaction that's turned serious or an immune response.
Okay, so they are being prepared that it's not going to cover everybody.
They know that, but they're giving blanket immunity to companies that make vaccines and those who distribute it.
Okay.
So in order to be able to give blanket immunity for lawsuits and tort, then they have to provide some kind of a mechanism, a no-fault program that people can file their cases and get compensated if they're injury. And that way companies who make those vaccines don't feel like, well, it's not really worth it for us to take the risk.
Yeah, when you say injury, that seems so crazy. People are just, oh, I was sick, or I had what injuries can people get I remember, I still have my chickenpox scar. That's my injury from that thing. But
right.
you're right. What is an injury?
So we're talking about things like, a lot of people who've had the recent vaccines, say, have a mild fever, they might have some aches, and that's just a sign of their immune system being activated. It's exactly kind of what it's supposed to do. It's supposed to activate the immune system. In a small fraction of people, it can cause things like Guillain-Barré, which is an autoimmune disease where it attacks the ability of nerves to propagate signals.
Goodness.
People can't move.
Okay.
There's vasculitis, where it's a generalized swelling of the heart or vasculature, or they have blood clots. In a small fraction of people, they have very debilitating injuries, and they need to have some recourse. They can't go to
because where would you go? Because you think, now, how am I going to go after the government? But there actually is a fund that the government is saying you can, so that at Ramos Law and the Medical Sciences
There's a very
Division.
specific procedure for taking the case through. You have to have a good understanding of the medical records and the biological basis of it, and you have to connect those dots to their injury.
And that's where we leave you right now. All right, when we go back, everybody, we're getting into Africa and his work there with the pandemic. We'll be right back. Before the pandemic, we'll be right back. Kathy J. Oakwood Homes is an official partner of the Kathy J Show. Oakwood Homes, building happiness. Welcome back to the Kathy J Show, everybody. So we are talking today with Dr. Don Kupu, Dr. Don Cooper, who runs the Medical Services Division at Ramos Law. But Dr. Don Cooper is also a neuroscientist, everybody. And you have done so many amazing things that have helped so many people. Let's start with your work in Africa. So you worked in Africa with a bunch of farmers, and it involved diagnostic testing on the food, correct?
Right.
Explain that.
Well, so when I was a professor at CU, the Bill and Melinda Gates Foundation issued a request for proposals, and it was for an innovative Grand Challenge Exploration program, where they were requesting the use of cellular phone technology applied to diagnostics in Africa.
Okay.
And so we had been doing some work with those rapid tests like the lateral flow tests, and combining that with imaging technology that you could use on a phone.
Yeah.
And in order to quantify it. And so we were finding in the lab that we could get the sensitivity and reliability close to a $100,000 lab instrument.
That's
so we
crazy.
thought if we could apply that to one big problem in Africa, which was aflatoxin, which is a natural carcinogen. It's the most potent natural carcinogen, and it infects about 30% of their grain stores.
Okay, they're corn, right?
They're corn, yeah. And so we felt like if we could give farmers the power to use their own smartphones and cellular phones, which about 80% of them had, that would enable them to understand whether or not their food was toxic, or if they were going to buy grain, whether it had toxic levels of aflatoxin.
That's amazing. So the phone, they would just grab your phone really fast. So they just, I got the corn in my hand. And they would just grab your diagnostic test.
They would take it, they would extract it with an ethanol extraction, and they take those little lateral flow tests, kind of like a pregnancy test, or these antigen tests that you see now for COVID. And they would take that and they would use the phone to image it. It would quantify the signal and it would send it to the cloud, and then it would allow surveillance so that you could know if there was an outbreak in one particular area or another.
Wow, that's amazing. And so how did that then turn into you being able to help people with vaccinations and stuff? How did you go from helping with the food to, I mean, because first off, that app then went into 18 different countries that are helping farmers. People that have a high school education or less are able to use this and saving their lives with the food now that they intake. How did it go to, now we can help you with vaccinations?
Good question. So we called this the Lab on Mobile Device Platform.
Okay.
And it was something that the CDC was interested in, Task Force for Global Health. They asked us if they could use this technology to help them eradicate a parasitic disease that causes elephantitis in children called filariasis in Haiti. So the CDC started using it. They started using it for eradication programs for malaria in Tanzania and pregnant women. And it just started expanding beyond what we'd initially intended it for food safety into lots of other diagnostic purposes. And this was before COVID hit. When COVID hit, Joe and I were good friends, and he said, can you apply this technology in Africa? Is there some way that you could apply this domestically and help us out with the ER? Can this help keep people from coming to the ER for basic diagnostic purposes?
Yes.
And so his idea was that, well, if you could take your diagnostic, if it can be done at home, then it should be done at home.
Right.
If you could do treatment or diagnostics at home, then why not do it there and save people the trip, risk getting people infected?
Absolutely.
And so when COVID hit, we pivoted and we started developing this technology. We set up a couple clinical trials. We actually had the first clinical trial for COVID-19 self-testing back in March of 2020, right when the pandemic started.
Crazy. So what do you mean? You already knew something was coming, neuroscientist? How did you already know in March to start a trial?
We knew that if the pandemic was going to go the way it was, that there wasn't enough testing infrastructure. We had to do more democratization of this diagnostics. We had to put diagnostics in people's hands. And as we can see now, that's what's happened.
Yes.
The FDA stepped it up. They issued a number of EUAs to allow rapid tests, and now we have home testing. You can go to Walgreens and you can get a test. This is something that was unheard of even 3 years ago.
Yeah.
There was a slow evolution of this technology, but FDA had really been slow in adopting it. Recently, it's really taken off.
Yes, it has. It's been amazing. And so pivoting through the pandemic, everyone did that. But now can I do anything with that rapid test that with a diagnostic on the phone? The phone doesn't really help. You're just saying the technology is now there for all of us to do the rapid test at home, right?
So yeah,
with COVID.
The technology exists from a number of different labs, so they've gotten EUA approval. We're submitting EUA approval for a diagnostic, Joe and I.
Yes.
It's something that we're going to apply. We've applied this kind of background towards understanding now with the vaccines. We can measure vaccine antibody response, but we just have a general understanding of vaccine technology and how it can, in some cases, cause injury.
Yeah.
And that's something that we're intending to address with the medical sciences division.
Yes. Okay. So everybody, speaking of that medical sciences division, there is a way that you can actually get involved and be a part of a trial that you guys are having, right? You need people to participate in a trial. We'll tell you about it coming up next. Fascinating, Dr. Cooper. That's so cool. We'll be right back, everybody. Kathy J. The Colorado Lottery is an official partner of the Kathy J Show. Colorado Lottery, play on. Welcome back to the show, everybody. So we've been hanging out with Dr. Cooper this half hour, and I'm certainly smarter. But Dr. Cooper, I can't let you go without asking you about the new variant that we're hearing about, Omicron, for COVID-19. What do you know about it as a neuroscientist?
Well, this is a new variant that recently has been discovered in Colorado. It's found in Boulder wastewater, so that they believe there's a low level of community spread.
Wow.
It was initially, like most of the variants, came out of South Africa, and this particular one has a lot of mutations, especially in the spike protein, and it's something that the initial evidence that they're coming out with right now is that it's as transmissible right now as the major Delta variant. It doesn't appear to have an increased severity of illness, but what we're seeing is that there's about a 40-fold drop in the neutralization ability of plasma, convalescent plasma with antibodies for those who have recovered. And when they test that in the lab, it appears as though it's escaping neutralization from previous infection.
Oh, okay. Meaning people aren't getting rid of Omicron as easy as they got rid of COVID-19.
So what that means is that the chances of being reinfected are much higher.
Okay.
So if you've been infected with a previous variant of COVID, then if you encounter Omicron, then the chances are that you will get reinfected, whereas you wouldn't with another variant, simply because of the mutations.
Wow, okay, like your body recognizes it almost and is like, you can come in?
It's the other way around, is it doesn't recognize it, and so it allows it to go.
Wow, okay, that's fascinating. Okay, now let's talk about the trial that Ramos Law is asking for participants for. What is it? Okay,
so Joe and I have been working together on a clinical trial before. I told you about our trial on self-testing for antibodies when it first came out back in March of last year. With this vaccine injury, we were very interested in understanding the etiology or the biological source of how do vaccines cause injury in people.
Right.
We know that we've heard about people getting injured shoulders. We know that they're having vasculitis and neuritis and some general inflammatory problems, but we want to understand more about how do these symptoms manifest and what's the biological basis. We're interested in people coming to us who have participated in FDA trials, in the vaccine trials. We want to hear more about their adverse reactions. We want to find out about anybody who's had a serious adverse reaction, and we're setting up a national database.
Okay.
It's in clinicaltrials.gov, and I think you have the link posted.
Yes, we do. Yes, we have.
And they can go there. If they've had a significant adverse reaction, they can go to that site, they can call Ramos Law, and we will take their information and we will investigate that. And then if there's a chance that they have a possibility, if Congress allows COVID vaccines, which we expect that they will, into this vaccine injury compensation program, then we want to be a leader in this field where we understand the biological basis of the injury, so we can put forth the best case possible to help people get the compensation that they may deserve.
And it makes sense because now you have Joe, Dr. Ramos, who is a doctor and a lawyer, so he's got that covered. Then he brings you in to explain how the virus works, how it has affected their body, neurologically, anything. It's like you can't lose with the Ramos team when you're going for it. So if you're having any side effects or anything, anybody, they want to hear from you at Ramos Law. And thank you so much, Dr. Cooper, for being here. Thank you. I could ask you questions all day. Like, we do need to be washing our hands as much as they say, right?
I would hope so.
Okay, good. That's fine. I just want to make sure you wash yours as much as I wash mine. Ramos Law, everybody, they're not just out there helping everybody get justice. They also are doing so much for their community. We talk about it all the time. But right now they're teaming up with New Beginnings Ministry, everybody. And they want to support families. They have 150 families that have signed up this year. Food boxes and gift cards. They're Christmas baskets that they're making for these families. If you want to contribute to these Christmas baskets, please, it's a tax-deductible donation, cash or credit card. We have the email right there to Sharon V. Hill, who's taking all of your requests and can help you. Also, if you want to maybe donate a basket, they're also taking that. But the deadline for all of it is next Wednesday, the 15th. Thank you so much. And to connect with Dr. Don Cooper in the Medical Sciences Division at Ramos Law, 303-733-6353, or go to ramoslaw.com. Dr. Cooper, thank you so much. Do you wear your mask everywhere you go? We're vaccinated, so
everywhere I go.
Everywhere. So so that those things can help us protect ourselves, correct?
Yeah. They protect against the particles when you're speaking.
Exactly, the particles when you're speaking. And people can do at-home rapid tests. They work just as well. You support those, and
absolutely.
Yes, and thank you for everything you're doing in the rest of the world to make sure that everybody's safe. You never even think about it. It starts in the food. It's everything. Thank you. All right, everybody. Thank you so much. You can always find me at KathyJShow.com. Have a good one. Thanks, Dr. Cooper and Ramos Law.